The quest for a youthful appearance is a tale as old as time. In today's world, we find ourselves with more options than ever before. Two popular choices are Botox and plastic surgery. This essay will explore the differences between these two approaches. Our goal is to equip you with the knowledge to make informed decisions about your aesthetic journey. We will delve into the specifics of each procedure, compare their invasiveness, and discuss the longevity of their results. By understanding the nuances of Botox and plastic surgery, you can confidently navigate the path toward achieving your desired aesthetic goals. Botox and plastic surgery both offer remarkable ways to enhance your appearance. However, they address different aspects of aging and aesthetics. Botox, a minimally invasive procedure, utilizes a purified protein to temporarily relax specific facial muscles. This relaxation effectively diminishes the appearance of wrinkles and fine lines, particularly in the forehead, between the eyebrows, and around the eyes. Plastic surgery, on the other hand, encompasses a wide range of surgical procedures designed to reshape and restructure facial features. Facelifts, for instance, address sagging skin and jowls, while rhinoplasty reshapes the nose. Understanding the core purpose of each procedure is crucial in determining the best fit for your individual needs. One of the most significant distinctions between Botox and plastic surgery lies in their invasiveness. Botox injections involve using a very fine needle to administer small amounts of botulinum toxin into targeted muscles. This minimally invasive procedure typically requires no anesthesia and involves minimal downtime. Plastic surgery, being a surgical procedure, is inherently more invasive. It often requires general anesthesia, incisions, and a longer recovery period. The level of invasiveness varies depending on the specific procedure. A facelift, for example, is a more extensive surgery than an eyelid lift. The results of both Botox and plastic surgery come with their own timelines, each offering unique benefits and considerations for those seeking aesthetic enhancements. Botox injections typically yield noticeable results within a few days, often providing a quick and effective solution for those looking to reduce the appearance of fine lines and wrinkles. With the full effect becoming apparent within a week or two, patients can enjoy a smoother, more youthful appearance relatively quickly. The muscle relaxation and wrinkle reduction effects of Botox typically last for 3 to 6 months, making it a popular choice for those seeking temporary but noticeable improvements. After this period, repeat treatments are necessary to maintain the desired results, and many patients find that regular appointments help them keep their appearance consistent and refreshed. Plastic surgery, in contrast, often provides longer-lasting results, making it an appealing option for those looking for more permanent changes. While the longevity varies depending on the procedure and individual factors such as skin type, age, and lifestyle, many plastic surgery procedures offer results that can last for several years or even decades. For instance, a well-performed facelift can take years off your appearance, providing a significant boost in confidence and self-esteem. The results of a facelift can last for a decade or more, making it a worthwhile investment for those seeking long-term rejuvenation. However, it's important to note that while plastic surgery can offer dramatic and lasting results, the natural aging process continues. Over time, patients may notice new signs of aging or changes in their appearance, which might lead them to consider additional touch-up procedures to maintain their desired look. Consulting with a qualified plastic surgeon can help individuals understand their options and develop a personalized plan to achieve and maintain their aesthetic goals over the long term. The cost of aesthetic procedures is often a significant consideration. Botox injections are generally priced per unit, and the total cost depends on the number of units required to achieve the desired outcome. The price can vary based on factors such as the geographic location and the expertise of the injector. Plastic surgery procedures, being more complex and involving operating room fees, anesthesia and surgeon's fees, are typically more expensive than Botox. The cost can vary widely depending on the specific procedure, the surgeon's experience, and the geographic location. It's crucial to discuss the costs and financing options with your chosen provider during the consultation. Determining the ideal candidate for Botox versus plastic surgery involves considering various factors, including age, skin condition, and desired outcomes. Each procedure has its own set of benefits and is tailored to address specific concerns. Understanding these differences can help individuals make informed decisions about their cosmetic treatments. Botox is often a suitable option for individuals in their 30s to 50s who are seeking to address early signs of aging, such as fine lines and wrinkles. This non-surgical treatment is minimally invasive and involves injecting a purified protein into targeted muscles to temporarily relax them. The result is a smoother, more youthful appearance without the need for surgery. It is particularly effective in treating dynamic wrinkles, which are those caused by repetitive muscle movements like frowning or squinting. These wrinkles can become more pronounced over time, and Botox can help soften their appearance, providing a refreshed look. The effects of Botox typically last 3 to 6 months, making it a convenient option for those looking for temporary improvements. Plastic surgery might be a more appropriate choice for individuals with more advanced signs of aging, such as significant skin laxity, deep wrinkles, or loss of facial volume. Unlike Botox, plastic surgery offers more permanent solutions by physically altering the structure of the skin and underlying tissues. Procedures like facelifts, brow lifts, and eyelid surgeries can provide dramatic and long-lasting results. It is also a suitable option for those seeking to reshape facial features, such as a rhinoplasty to reshape the nose or a facelift to address sagging skin. These surgical procedures can significantly enhance facial harmony and boost self-confidence. While the recovery time is longer compared to non-surgical treatments, the outcomes can be life-changing for many patients. Consulting with a qualified healthcare professional can help determine the best approach based on individual needs and goals. As with any medical procedure, both Botox and plastic surgery come with potential risks and side effects. It's important to be well informed about these before making any decisions. Understanding the possible outcomes can help you make a more educated choice and prepare for any eventualities. Botox injections are generally safe when administered by a qualified and experienced injector. These professionals have the necessary training to ensure the procedure is done correctly, minimizing the risk of complications. However, it's essential to verify the credentials of your injector to ensure they are certified and experienced. However, potential side effects can include temporary bruising, swelling, or redness at the injection site. These are usually mild and resolve on their own within a few days. Applying an ice pack can help reduce these symptoms. It's also advisable to avoid strenuous activities and excessive sun exposure immediately after the procedure. In rare cases, patients may experience drooping eyelids or eyebrows, but this typically resolves within a few weeks. This can occur if the Botox spreads to adjacent muscles. To minimize this risk, follow your injector's post-treatment instructions carefully, such as avoiding rubbing the treated area. Plastic surgery, being a more invasive procedure, carries a higher risk of complications. The nature of surgery means that the body undergoes more significant changes, which can lead to a variety of issues. It's crucial to have a thorough consultation with your surgeon to understand all potential risks. Potential risks can include infection, bleeding, scarring, and adverse reactions to anesthesia. Post-operative care is vital to ensure proper healing and to minimize these risks. Following your surgeon's instructions regarding wound care, medication, and activity restrictions is essential for a smooth recovery. It's crucial to choose a board-certified plastic surgeon with extensive experience and to carefully follow pre-operative and post-operative instructions to minimize risks. Researching your surgeon's background, reading reviews, and asking for before and after photos of previous patients can provide additional assurance. Remember, the success of your procedure greatly depends on the skill and expertise of your surgeon, as well as your adherence to their guidelines. The decision of whether to choose Botox or plastic surgery is a personal one. There is no one-size-fits-all answer. The best approach is to schedule a consultation with a qualified and experienced provider who can assess your individual needs, discuss your goals, and recommend the most appropriate course of action. Remember, the journey to a more youthful and refreshed appearance is a marathon, not a sprint. By understanding the differences between Botox and plastic surgery, weighing the risks and benefits, and consulting with a qualified provider, you can make informed decisions that align with your aesthetic goals and enhance your natural beauty.